Hello everyone, I'm here today to establish a new political party named People's Power. So, who are we? We are a democratic party who believes in housing, healthcare, and the well-being for all citizens. In today's world, it is crucial to address the pressing issues that affect the lives of our citizens. This manifesto focuses on three key areas: housing, healthcare, and the well-being of our citizens. We believe that by addressing these topics, we can create a society that values and supports every individual. To start off, I will be addressing housing issues. To address this housing issue, we have three stakeholders. The first stakeholder are homeowners, the second one are renters, the third one are developers. Homeowners value stability and property ownership. They seek policies that protect their investments and maintain property values. Renters prioritize affordable housing options and fair rental regulations. They aim for a secure tenancy and protection against unjust evictions. As for developers focus on profit generation and economic growth. They advocate for flexible regulations and incentives to encourage new construction. As for the policies to address these housing issues, first of all, we would need to implement programs that provide financial support and incentives to developers for the building affordable housing units. We would need to allocate funding for affordable housing projects, provide low-interest loans to developers, and offer grants for the construction of affordable housing units. Second of all, we would need to introduce reasonable rent control policies to protect tenants from excessive rent increases by establishing rent increase limits tied to inflation rates, create mechanisms for rent stabilization, and enforce penalties for landlords who violate rent control regulations. And lastly, we would need to establish stricter regulations against unjust evictions, ensuring tenants have adequate notice and legal recourse by extending eviction notice periods, providing legal aid to support tenants facing eviction, and create mediation programs to resolve landlord-tenant disputes. Required involvement includes government housing agencies, non-profit organizations, and real estate developers. First of all, they would need to collaborate with government housing agencies to provide funding and resources for affordable housing initiatives. We will take action by increasing the budget allocation for housing agencies, streamline for the application process of housing assistance programs, and enhancing coordination between agencies to maximize efficiency. We would also partner with non-profit organizations to specialize in housing assistance to provide counseling, support, and affordable rent options. We will take action by forging partnerships with non-profit organizations to expand housing council services, establish additional housing programs for vulnerable populations, and offer rental subsidies for low-income individuals and families. We would also encourage developers to participate in affordable housing programs through tax incentives and partnerships. We can take action by offering tax breaks and incentives to developers who allocate a percentage of their projects to affordable, create public-private partnerships to facilitate affordable housing construction, and establish mentorship programs for emerging developers in underserved communities. As for addressing these healthcare issues, our stakeholders are patients, healthcare providers, and insurance companies. Patients seek accessible, affordable, and high-quality healthcare services. They desire comprehensive coverage and timely medical attention. Healthcare providers prioritize fair compensation, reduce administrative burden, and improved patient outcomes. They aim for a sustainable healthcare system. As for insurance companies, they manage risk and ensure profitability. They advocate for cost-effective policies that balance coverage and premiums. To solve this, our policies are: first, we would establish a comprehensive and accessible healthcare system that provides coverage for all citizens. First of all, we would have to establish a comprehensive and accessible healthcare system that provides coverage for all citizens. We would have to develop a single-player healthcare system or a hybrid model with a mix of public and private options. Ensure coverage for essential healthcare services, prevent care, and chronic disease management. Second of all, we would have to implement policies to reduce the administrative burden on healthcare providers and ensure fair compensation for their services. We would have to simplify billing, administrative processes, invest in healthcare information technology infrastructure, and establish transparent reimbursement systems based on quality outcomes. Lastly, we would have to introduce measures to control healthcare costs, such as negotiating drug prices and promoting cost-effective treatment options. We would allow the government to negotiate drug prices with pharmaceutical companies to promote the use of generic medication, establish price transparency in healthcare services, and incentivize the adoption of evidence-based and cost-effective treatment protocols. Required involvement are government health agencies, medical associations, and insurance industry representatives. We would have to collaborate with government health agencies to develop and implement universal healthcare coverage plans and cost regulation measures. We would take action by establishing dedicated task force to study and propose healthcare reform strategies, allocate funding for the expansion of healthcare infrastructure and services, and enhance coordination between different healthcare agencies. We would also engage medical associations and professional bodies to ensure the involvement of healthcare providers in policy development and implementation. We would take action by facilitating regular dialogue between medical associations and government agencies, involve healthcare providers in decision-making processes, and create platforms for sharing best practices and innovations in healthcare delivery. And lastly, we would work with insurance industry representatives to strike a balance between affordable premiums and comprehensive coverage. We would take action by collaborating with insurance industry stakeholders to develop standardized insurance plans, establish guidelines for premium affordability, and encourage the inclusion of preventive healthcare and wellness programs in insurance coverage. As for our last issue, the well-being of our citizens, we care deeply about our citizens. So, first of all, our stakeholders would be these individuals, community organizations, and corporations. Individuals prioritize physical and mental health, work-life balance, and personal fulfillment. They strive for a supportive and inclusive society. Secondly, community organizations aim to strengthen social connections, promote civic engagement, and address the needs of vulnerable populations. And thirdly, corporations recognize the importance of employee well-being and societal impact. They seek to foster positive work environments and contribute to community initiatives. To address these issues, we would have to implement these policies. First of all, for mental health support, we will increase funding for mental health services, including counseling, therapy, and community support programs. We will expand access to mental health services in underserved areas, provide training for mental health professionals, and integrate mental health support in primary healthcare settings. Secondly, for work-life balance, we will promote policies that encourage flexible work arrangements, parental leave, and vacation time to enhance work-life balance. We will advocate for legislation that supports flexible work hours, promote telecommuting options, establish paid parental leave policies, and encourage employers to provide sufficient vacation and personal time off. Thirdly, for community engagement, we will support community organizations through grants and partnerships to empower local initiatives and address societal challenges. We will allocate funds for community development grants, establish collaboration platforms, platforms between community organizations and government agencies, and promote community engagement through volunteering and civic participation. As for required involvement, we have government social services, non-governmental organizations, NGOs, and corporate social responsibility CSR programs. Firstly, we will collaborate with government social services agencies to allocate funding and resources for mental health support and community engagement programs. We will take action by increasing funding for mental health clinics and programs, enhance training for mental health professionals, and establish partnerships between social services agencies and community organizations. Secondly, we will partner with NGOs specializing in mental health and community development to provide expertise and on-the-ground support. We will take action by fostering collaboration between NGOs and government agencies to leverage resources and expertise, provide grants and funding opportunities for NGOs, and facilitate knowledge sharing and capacity building. Lastly, we will encourage corporations to allocate resources and engage in CSR programs that promote employee well-being and community involvement. We will take action by recognizing and rewarding corporations that demonstrate CSR practices, establish platforms for knowledge sharing and collaboration among corporations engaged in CSR, and provide tax incentives for companies that invest in employee wellness and community development. And my speech ends here. Together, we can build a better future for all citizens, where everyone has access to housing, healthcare, and a high quality of life. Let us join hands and work together for a brighter tomorrow, where no one is left behind. By embracing these principles and taking actions, we have the power. People power. Unite for a better tomorrow. I'm Monique, and I approve of this message.